Hello there. I've been down in outpatients for nearly a year now, worked in wards and ambulatory care previously, but I absolutely love my job down in outpatients. In the morning we come in and we meet before we've even started, and we can go through some mood vision cards. That just actually allows us just to reflect a little bit how the team feeling, how we're working together, and what kind of mood we're all in. Sometimes we could be in a sad mood that nobody's even actually recognised. Allocated rooms or room to consultant that we work with. The room's usually set up, or we set it up with various different equipments that we're needing. Depending upon what the nature of the clinic that we're doing, we're checking the patients, the weights, the heights, the blood pressure and the pulse, and we identify the patient's needs. We chaperone with our consultants, registrars and doctors, doing the examinations, taking bloods, doing ECGs. Different kinds and types of clinics that we do down in outpatients, absolutely numerous. Surgical, pain, neurology, medical, urology, vascular, rheumatology, cardiology, respiratory, oncology, diabetes, ENT, head and neck, voice, breast, weight management, dermatology, which I really do love. I love the very much hands-on approach. The morning clinics can be completely different to the afternoon clinics. You're not necessarily on the same kind of clinics. Not all clinics are down in outpatient. Oncology, the Macmillan Centre, where we can do bone marrows. X-rays, where we do the RFAs, vascular pain, surgical. Cludon, which we do the diabetic, weight management clinics, which we actually download meters, pumps, which we also entails computer work and various testing machines to be programmed. We have various numerous one-stop clinics, tracking patients, taking them into the consultants, doing the x-rays, bloods, tests, mammograms, PFAs, which is respiratory clinics are based through, back to the consultant, and making sure that they've actually gone through the whole procedures, which could actually mean patients could even be here for 2 or 3 hours, but it enables the one-stop clinics. Some clinics are more hands-on. ENT, where we can do scopes, ear suctions. Surgical, where we can do scopes as well. Dermatology, which we do biopsies, even to identify skin cancers and remove growths. Cutting out tissues which we help suture up and give the patient information leaflets and give them support, even if that means just a reassuring holding their hand. The reasons I love my job is because it is so varied, so very fast-paced. Some clinics are more slower due to the nature of the consultation. I feel we are very appreciated from the patients and our consultants. Many of our familiar faces, we see the patients returning. Our patients are very much needed to support and needed to be supported by us. Some get bad news, some get good news, but we are one big team and we're able to comfort the patients. The teamwork between us all, we work very well together as an outpatient, providing a good support network, whether we were helping someone to get dressed, holding one's hand, or smiling and laughing with them. At the end of a shift, we'd meet again and do our mood cards, which reflect back on how our days have gone and how we can have even made it better or what's gone well. I find my job very interesting, satisfying, rewarding, self-develop within myself. I get more out of my job, whatever I put in, more comes out of it. It makes me appreciate what life is about.
So, Joanna Birch, obviously you're the nurse in charge and helping to lead the change that's happening in outpatients. Can you just outline exactly what you've been involved in terms of the team building etc.?
Okay, so we have a very clear vision for 2016 to continue to develop all staff skills across the specialities in the outpatient department. Our overall aim is to provide the training for every member of the team to be flexible and to feel confident to rotate around the specialities in the department, including the general outpatients, the ambulatory care treatment, diabetic centre and all procedure clinics. We have, over 2015, co-created a healthcare support worker passport, and we've now completed 5 competencies relevant to outpatients. These are including venipuncture and cannulation, ECG, mentorship and coaching, aseptic techniques and vital signs and patient observations. We're now in the process of developing our 2016 passports with 5 new key competencies. This work has been key in streamlining the patient's experience, and rather than patients, for example, requiring to go ECG department during their cardiology consultation, they can receive their ECGs within outpatients by a member of our team. This is so important for patients to receive a positive experience in outpatients, and I consider personally the outpatients department to be a bit like the shop window of the hospital. If your experience is good at the initial consultation stage, your perception of efficient and knowledgeable care on the next stage of your journey in D&GRI is good, reducing anxiety for patients. If a shop window is not well presented, you're less likely to want to go in, and if then your overall perception is very low. Over the past 6 months, we've been using Envision mood cards, as Trudy described, to help the team to firstly build good, strong working relationships by connecting emotionally with each other. This helps us to understand how people are feeling by listening to each other, and we do this at the start and the end of every shift. If we work well together as a team, our care towards patients is ultimately better. Overall, we are working towards a new hospital and building a skillful team who will work well together to provide smooth, efficient patient care and provide excellent healthcare, creating a positive experience for every patient, every time.
My name is Arlene Horsburgh and I'm the charge nurse in outpatients. The management and delivery of outpatient services is complex, as patients may be seen by clinical and non-clinical staff in different disciplines. My main roles are: 1, to ensure that outpatient services are patient-centred. Clinical teams have and are reviewing their pathways. We have commenced one-stop clinics from this work. 2, to develop a culture of improvement. Changing the way things have been traditionally done is never easy, but taking small steps at a time will mean that we are ready when moving to the new hospital. 3, ensure that the workforce have the skills to work within any clinic. All staff have skill passports and are working towards completing them. 4, I'm also involved in the service redesign for the new hospital. We are looking at different ways of working, the patient pathways and manpower, as the department is going to include all the dermatology services, pre-assessment and ambulatory care. My vision for the future is that access into outpatient services is timely, with the right patient being seen by the right people at the right time and place.